Hi, my name is Emily, and I'm Children's Miracle Network champion.
Emily was always really small. When she was born, she was 5.5 pounds, and she was just tiny, but she ate more than like a 1-year-old would eat. But she still just remained really small, and so also we were first-time parents, and I think we were just worried a lot.
I don't think it helped that I was in medical school. I think they were thinking that I was too worried. But when I was speaking to the nutritionist and I said, Chrissy and I have this feeling like something is wrong, but it feels like nobody will listen to us. And she said, well, have you ever had a sweat test done? And as soon as she said that, my heart just dropped. I knew that my daughter had a lethal genetic disease.
Cystic fibrosis is a medical condition that affects certain organs in the body. The earliest sign usually is that the kids have trouble growing because the pancreas doesn't work, and the pancreas makes digestive enzymes. So without the ability to break down food, there are problems with growth. Another problem, and actually the main problem, is the lung disease. The lung has thick, sticky mucus in the airways, the bronchial tubes. And then that mucus gets infected. And slowly, over time, that leads to lung destruction.
We were living in New Orleans, and we planned when he finished medical school to move back to Casper, Wyoming. First of all, because our family was there, and also Denver Children's Hospital was ranked in the top 3. And so that also was a big factor. But when Hurricane Katrina hit, we had to evacuate.
They basically took me in as a medical student at the University of Colorado, and I actually got to do some clinic work with Dr. Accurso, which was really great, and get to know him a little bit personally. A lot of the research that he's involved in is pretty cutting edge. It made me feel really comfortable about our decision to have Emily treated here.
There's an old saying that it's not just the child that has CF, it's the whole family. Because a lot has to be done for that child, a lot of energy and time. Clinical trials are extremely important. We have to make things better for people with CF. And the only way we have to do that is to learn about the condition by studying children with CF and adults.
Being able to participate and try to help find a cure, it's great. You know, it's really empowering. It's unfortunately all that we can do, but we're going to do whatever we can. She spends at least an hour and a half a day doing therapies that help keep her healthy.
Good girl.
She has to take enzymes every time she eats. The enzymes help her digest her food because her pancreas doesn't work properly. She takes extra vitamin supplements. She has to be sure she gets enough salt and fluids. Every day, Emily has to do airway clearance with a device. It's called the vest, which shakes. And during part of this treatment, she has to stop and do some special coughing to get the mucus to come up and out.
Although life expectancy is improving, the life expectancy now is about 37 years. People dying from CF, about a quarter are under 18 years of age.
Unfortunately, I've seen kids that are really sick with cystic fibrosis, and it gives me a lot of fear. It's really hard to think about Emily having to go through that. I think that's one of the reasons that we really do try to live in the now.
When I grow up, I want to be a dance teacher. I do ballet, tumbling, and hip-hop sometimes, and jazz.
She's really, really smart. Ever since she started kindergarten, her test scores for reading have been like off the charts. She loves to be with friends. She likes to ski. She likes to play soccer.
Yeah, outside of her therapy, she's just a normal little kid. I want to always think about the positive things and the fact that she could actually have a normal life, and there could be a cure right around the corner. And that's really the place to focus.
Since infection is the main problem in the lung, we have new antibiotics that basically are developed specifically for people with cystic fibrosis. But what we're most excited about is agents that will correct the basic defect. Just in the last year, really, we've had evidence that we have a way to make the abnormal protein work better, not just treat the secondary effects. If that can be done in 10, 15 years, this condition could be treatable such that people are living close to normal lives.
I think Emily is a champion because she has a very positive outlook. She's a happy little girl. She seems to take her CF care in stride every day.
There's an old saying that cystic fibrosis gene is a gene for charm, and that's Emily.
She's an angel. She gets up and does what she's supposed to do every morning. She never complains about it. She knows it's just part of her day and it will help keep her healthy, and she has a very good attitude about it.
A lot of people in Wyoming come to Children's Hospital, and everyone who comes to Denver Children's Hospital just loves it. It's so nice that it is close enough for us to go to. I mean, we're really lucky.
The research is going very, very well, and the treatment that allows them to live a normal life may be on the horizon.
My favorite theme is that everybody works hard to make me better.